Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. Are you doomed if you've just been given a diagnosis of a disc herniation? Doomed via the disc herniation diagnosis, all right? In this video, I want to share with you lots of kind of different insights. If you've been told you have a disc herniation and you're worried, you're concerned. Every day I have people that reach out to me, they send me pictures of their disc herniation. They show me MRIs, they send me reports, X-rays, all that, right? And they circle on the MRI, right, the disc bulge. And they say, hey, this is bad, or ouch, or what do you think of this? And so I want to help put your mind at rest by giving you some knowledge and understanding of what disc herniations sort of are, what they mean, right? The different types. Are you going to have to live with it? Is it something that can heal naturally? Is it something that can't? And so if you have lots of questions floating in your head and you are looking for some answers, then again, I want to pass this along because I think this can be really reassuring to you. Again, for those of you who do not know me, my name is Dr. Charlie Johnson. I'm a PT. I'm a board specialty in orthopedics, and I teach people like you how to resolve these problems naturally. So keep that in mind if you're looking for a natural approach and want to learn how to fix yourself. And then also, if you're not sure if you're watching the right video, because you're like, hey, I don't know if I have a disc problem, be sure to check out my Better Than an MRI DIY diagnostic guide, where I outline my entire diagnostic flowchart and or algorithm for figuring out the most likely source of your back, butt, or sciatica problems. Thanks so much. Let's dive into it. Disc bulges and herniations, what you need to know. Let's dive into it. In this training, we're going to cover why X-rays and MRIs are generally not recommended for most disc injuries or back problems. You can determine with a high certainty or probability that a disc problem is causing your pain without needing these things, without needing these costly pictures, if you will. We're also going to talk about the different types of disc herniations or bulges. As you'll see, there's many different terms, but they're sort of different types. How the size of the disc bulge or herniation impacts your ability to heal and your chances of needing surgery, all right? Plus, we're going to chat about the research. I know, kind of boring stuff, but this is the stuff that exists sort of in this ivory tower, right? Outside of maybe your ability to access and in the minds of people like myself who are specialists in this area. And I want to share that with you. I want to bring it down to earth and just expose this. This way you don't have to go hunting for it. So we're going to talk about the evidence or the research, the science, if you will, as well as theories behind how discs heal naturally, if they do heal at all, right? Let's chat about that. And why you should care about all this and what it means for your recovery, especially if you're trying to recover naturally. All right. So to kick things off, I want to start with a few images, all right, to see where you're at. So look, as someone with back, butt, and or leg pain, how do you feel when you see these things? Right. So look at this picture. How do you feel when you see this? Right. You can see I've circled it there. Right. Here's another one, right? How do you feel about that? Every day, people send me pictures that look like this, right? And they ask me how I feel and how I think about it. First, I want to ask you how you think about it, all right? So what do you feel and what do you think, right? When you read or you hear this now, right? This is like a summary, if you will, of the findings of an image. So impression, right? Stress reactive marrow edema involving the T12 right anterior laterally. Try to say that 5 times fast, right? Multi-level degenerative joint disease, degenerative disc disease, L3, L4, L4, L5, severe stenosis, disc bulging causing moderate right foraminal narrowing. What does all this stuff mean? This is like gibberish potentially to you, right? Do you feel happy, right? Or do you feel worried? Do you feel fearful? Do you feel anxious? Probably, right? And, you know, a lot of emotions pop up when people read these things. You might have questions too, like, hey, will I need surgery? Will I be able to get back to running or hiking or biking or whatever it may be, right? You may have seen me mention in my previous videos about how pain is an experience, and it's created by a constant interaction between the mind and the body. Everything is connected. So they're not separate things. You can't separate them, right? Again, you move and it hurts. The more it hurts when you move, the more you start to kind of associate movement with pain. You start to strengthen this movement-pain relationship. And by the way, the more you start to become more fearful, more anxious of movement, the more avoidant you become. And then you move less. The less you move, the more fearful you become. The more fearful you become, the less you move. Before you know it, you're stuck in this trap. I call it a negative feedback loop. All right. Many people start their quest for pain relief by believing that they first need to figure out what's going on, usually by means of an X-ray or MRI. Again, check out that Better Than an MRI DIY diagnostic guide. Cannot tell you how many people it has saved from having to get these images because based off your story, where you hurt, and things that make you feel better or feel worse, you can figure out the most likely source of your symptoms, right? And look, it makes sense you feel you need those things. This is just how we've been brought up, right? This is what we've been taught. But the problem is that what you see and what you hear cannot be unseen and or unheard, right? So look, maybe you have an MRI now, And in 6 months, maybe you don't remember exactly getting that MRI. All you remember is you were locked in this tube, right? And they told you some nasty stuff. Or maybe you had multiple MRIs in the past. But if you've been shown that black and white picture, they slapped it up on that light box, right? And they circle and they point to it with their laser pointer, with their finger, some really smart person, right? Then it's really hard to unexperience that, right? It's sort of like a train wreck. You just replay that image. We think in images. So you replay that image over and over and over again, and that will live on. But evidence clearly shows, in my experience as well, as somebody who only helps people with these issues, that people who get X-rays and MRIs do worse than people who do not. Same disc problem, same degeneration, same stenosis, but people who get an image have a harder time getting back to normal. Study that shows just that. Is it possible that MRIs and images do more harm than good? And it is very true. And yet we continue to order MRIs and X-rays at an alarming rate. Now, is it because, people who get MRIs or X-rays, they heal more slowly? They have something special about their discs that prevents them from healing? No, it's because seeing and hearing the results of their image heightens the pain experience, right? Mind, body, brain, body. Traps them in fear, gives them credible evidence. Oh my gosh, I remember that thing. We think in images, right? Stamps it, if you will, on your subconscious. Gives you credible evidence to believe that you're broken. And this is going to hold you back, right? It sort of brands that diagnosis on you. It labels you and becomes self-limiting, keeps you from healing. How can you possibly fix this thing, Charlie? Look at it. It's right there. Ouch. I hear you. Okay, so it often shifts your mental state from one of like, oh yeah, this hurts, I'm going to get over it. Imagine you're younger, you fall, you scrape a knee, whatever, you get up, you brush it off, I'm good, right? To, oh my gosh, like, dude, there's no way I can fix it. Did you see that? Like that jelly was out of the donut, right? I hear this stuff every single day. And from the moment that switch occurs, right, and that belief gets seeded or planted, the person in pain, you, becomes indebted by the very thing which they thought would help them figure it out. You thought that if you got an MRI or an X-ray, that you would figure out what was going on, that would free you, right? It would lead you to relief. But instead, it misleads you or it misleads people with these problems down a path of fear, worry, and frustration. It kickstarts a negative feedback loop. This is bad. This is a picture someone sent to me. This is bad, right? And this is what it looks like. You can see here. You get an MRI, right? You start to catastrophize about things. You start to Google it. You start to intensify the level of worry, fear, anxiety around the problem. You start to move less, avoidance, right? You become more hyper vigilant about what you're feeling. Oh, is that the disc? I felt like it went out. I felt like it went in. It shifted here. It shifted there. You start to become deconditioned, start to become depressed. This fuels the pain experience, and you start to worry more. And the way out of it is that we break that fear. Getting an MRI, getting an X-ray strengthens the fear. And you can see why it keeps people trapped in pain. We need to confront the fear. We need to reduce the fear and anxiety, and we need to understand, not blindly, but have faith in understanding that which I'm sharing with you today that helps free you up and allows you to recover. Funky stuff. Realize that disc problems are just as much about the physical side of things, and getting out of it also needs to involve the psychological side of things. All right. So why do I show you those images of, massive disc problems and herniations? Is it to freak you out? Is it to scare you? And the answer is absolutely no. You've already seen it probably. All right. And you probably sent it my way or sent it to someone else or, shared it with your friends or whatever. But actually it's just the opposite, right? To free you. So I want to let you in on something. All right. The larger and more severe the disc herniation, the better your chances of natural recovery. Right. And this might sound pretty crazy. All right. So let me bring you up to speed. There are three main types of disc herniations. So here they are, right? And explain from least to most severe. So you've got disc protrusions. This is often called some type of disc herniation or disc bulge, we'll say, right? You've got focal protrusions, and you've got broad-based protrusions. You've got disc extrusions, and then what we call sequestrations. Sounds kind of cool, but kind of scary at the same time. So here you go. So let's just say L4, L5 is the most common level of a disc herniation. You can see the bones. It's kind of the side of the spine on the left side. You've got the spinal cord that goes right behind the bones through the central canal. All right. Then you've got the little holes where the nerves exit. And obviously you've got those bones there again, L4, L5, they're the vertebrae. And in between, you've got this sort of ball bearing shock absorber, if you will, called the disc. Then what we do is kind of cut, if you will, and we look at the very top, like we cut a log in half, right? And we're looking at the top of the log. All right, you can see right here, this is the disc portion. The inner kind of lighter blue stuff is what we call the nucleus propulsus. The outer part is called the annulus fibrosus. It's like a wicker weave of fiber that helps hold in that nucleus, that disc material. So you can see we've got disc protrusion on the left. We've got this broad-based herniation, kind of spreads out, crosses the midline, goes right and left side. Not very big, but still broad, very wide. And then you've got a focal herniation. Many disc herniations, because of the back side of the spine, you have something we call the posterior longitudinal ligament. I'm not going to get too much into it, but it's sort of like a meridian. It's sort of like a divider. You're going down a highway and you have this like thin meridian. You have to go right or you have to go left. And so often disc herniations will occur back into one side or the other because, again, there's that ligament that kind of pushes it this way or that way. So again, you can see focal herniation. So disc extrusion, sort of the next level of severity, if you will. Let's just compare the protrusion versus extrusion. Okay, protrusion, the base is wider than sort of the herniation. All right. In an extrusion, you can see it looks a little bit more like teardroppy. All right, like if that were a water droplet, like it's gonna like fall off soon. Right. The base is narrower than the herniation. Sort of defines an extrusion. So an extrusion means that the disc material, the nucleus, if you will, is what a lot of people refer to as the jelly. It's mostly water, all right? But the nucleus of the disc has escaped through the disc, through the outer wall of the disc, through a fissure, through a crack, right, in what we call the annulus. So the tear in the annulus, and the disc material has actually left the disc, right? The disc is no longer what we call competent. It's not intact because there's a hole in the wall, if you will. Finally, disc sequestration. These things look really nasty, all right? As you'll learn in a moment, they actually don't have to be. And what this means is that disc material has escaped the disc and broken away from the disc, become what we call like a free floating fragment, free disc fragment. So again, if protrusion is like the water is starting to kind of accumulate, on the bottom of your faucet, but then, disc extrusion, it looks like a bubble and it's about to come off, right? The sequestration is that it's sort of dripped, it started to drip. So disc material has escaped the disc and has become this free, kind of independent floating fragment. It's broken off. So 4 stages of a disc herniation. I don't love this picture, but let's consider the generation and prolapse. Maybe mainly the prolapse is like the disc protrusion. All right, then you can see extrusion. So in the prolapse or the protrusion, you can see the disc wall, the annulus is still intact. The disc is what we call competent. The extrusion is where you have that tear and then the material comes out. The sequestration, you can see there's some stuff broken off. So now that you know what disc herniations are and sort of what they look like and the different types, I've got a quick question for you. I alluded to it earlier, but just curious to test your memory. If you had to pick, which herniation do you think would be least likely to heal naturally without surgery? Which would be the least likely of these things to heal naturally? Most people would say, man, that one looks bad. These are the pictures that I get to say, ouch. Man, I saw my image and like, oh, man, I need surgery. It doesn't look good, right? But this isn't true, right? This is really misleading. In fact, an interesting study published years ago found the majority of disc herniations heal with time and the right natural treatment. You need to follow a process, absolutely, right? If you're the bowling ball, the goal for me when I work with people is to be the bumpers. So this way you're not just doing a bunch of random stuff, right? Trying a bunch of random things, because you can absolutely make it worse. You need to follow the right process and the right approach, but with time and that right process, it can get better, right? And it actually showed in this study, the more severe the herniation, the better the chances of healing without surgery, right? It's pretty crazy and probably the opposite of what you thought. So instead of this being the one that's least likely to heal, this is actually the one that's most likely to heal, right? The one that you probably have looked at and said, ouch, Charlie, no way you can help me. How is that possible? Look at that. The jelly's out the donut. Actually, those are the most likely disc problems to heal, right? The worse the disc herniation, the better the chances of healing naturally. So here's specifically what was found for each type of disc herniation as it relates to natural healing, okay? The rate of what we call spontaneous regression. Yes, your body can absolutely shrink, reabsorb, and heal, just like it can a cut on your knuckle, right? Disc issues. 96% of disc sequestrations, this nasty one, right, can reabsorb or heal naturally. 70% for disc extrusion, 41% for protrusions, and they're classifying bulges as differently, but 13% for disc bulges. All right, so what does it show? The worse the bulge, the bigger the bulge or herniation, the better your chance of not needing surgery and healing naturally. All right, may again be counterintuitive what you thought or have been led to believe. All right, pretty amazing though. So just like every other tissue or part of the body heals, discs heal as well. In fact, most do so within a 6-month time frame, roughly 75% of people. They can take a little bit longer. So no, this isn't a quick fix. If you actually have a disc herniation, that is the cause of your symptoms. And I say actually because lots of people have them and don't feel anything. But either way, It just makes sense, right? So bones heal within 2 to 3 months. You could fracture your femur and within just 8 to 12 weeks, right? It's going to be good, right? Without any intervention, so long as it was aligned and all that. Muscles, a monthish. Ligaments, 2 to 3 months. Tendons, 3 to 6 months. Cartilage, maybe 12 weeks to 3 months, right? And then, like, do discs just never heal? Are they different than other tissues in the body? Are they outside of your body? They don't follow the same process? No, they don't take forever to heal. They heal like other things in your body, right? They follow the same process. And there's plenty of proof, right? So since many professionals and people use their images, X-rays, MRIs, and all the reports, right, as proof their spine is damaged, let's show you using the same X-rays and MRIs, proof that the spine can heal and the disc can heal. So here's an MRI of the same person's spine taken 6 months apart. One MRI, you'll see it here. On the left, looks pretty nasty, right? Disc extrusion. Then on the right, look, it's reduced significantly. Pretty cool. So let's go back to the slide for a moment. You might say, well, Charlie, I have a disc protrusion. So what do I do? Right? So you might be stuck in the stats of things. You're thinking, what about folks with, these not so bad things? Looks like most of them don't get better. But here's the good news, is that lots of people have these things and don't hurt at all. So these are people, this slide specifically, right? Very classic study that looked at image findings of people who have no pain, asymptomatic folks. Lined them up on the street, took images. Hey, do you hurt? No, I don't hurt. Hey, do you hurt? No, I don't hurt. Well, we're going to take a picture of your back anyway. This is what we found. 20 years old, 30% of people had disc bulges but felt no pain. 30 years old, it went to 40, 50, 60. And you can see it goes up sort of linearly. It doesn't mean that you have to hurt. And so you might be saying, well, Charlie, yeah, like a lot of people with these disc protrusions or bulges don't get better. They don't heal as well as the bigger disc problems. Well, who's to say that it wasn't just something that showed up on the image? And who's to say that it's caused your pain? Other than the image, of course. Lots of people have these things and don't feel anything. Disc degeneration, again, very common. Disc desiccation, your disc shrinking in height. Happens all the times, and people don't even know it. So it's normal to have these things, right? As well as a bunch of other things. But just like wrinkles on the skin, which don't hurt, just like your baldness on your head, but your head doesn't hurt, all right? Changes to your bones, joints, and discs are normal and to be expected. They are normal changes. They happen, and they don't have to be bad. And that's why X-rays and MRIs are not recommended for most back issues, because everybody has something wrong with them. And it's very misleading and often impossible to distinguish between normal and abnormal stuff. And unfortunately, though, if you don't know this, then you'll take the results of your image as proof and are like the reason why that something is wrong with you and the reason why you hurt. You'll actually resist healing because of what you believe now. I've got this thing and there's no way, Charlie, that you can reverse disc degeneration. Well, that's weird because your friend has disc degeneration and they don't hurt at all. Okay. One final thing that people want to know is, how do discs heal? How can you help me heal this? So a super simple answer is this: just like everything else in your body heals. That's the answer. Just like everything else in your body heals. Is that a surprise to you? Is your disc different? So look, you've got stages, if you will, of healing. You have the inflammation phase or inflammatory phase. Injury happens, inflammatory events start, right? Which signals to the body, protect the area, and send special healing cells, if you will, to the region. Then you have what we call the proliferation phase, basically saying the injured area starts to become rebuilt. Then you have the remodeling phase. All right? Scar tissue strengthens and final healing occurs. So it's sort of like a cut heals. It bleeds, it stops bleeding, a scab forms, all kinds of stuff happens, right? It falls off and your skin heals up. And look, there are many theories as to how discs heal, but just recognize, the only difference between a cut on your knuckle and your back, if you will, right? A disc problem, a tear on the disc or a little scab on the disc, right? Or a cut on the disc, is that you can see it. All right, sure, it's different tissue, and one might take longer. Disc might take longer than the knuckle, right? But you don't get freaked out about a little cut on your knuckle because you can see it. You can obviously feel it, and you can kind of see, hey, if I do this, it makes it better. If I do this, it makes it worse, right? It opens the scab. And so this is why so many people are addicted to X-rays, MRIs, and thinking that they need to see what's going on, even though they could have just looked into the Better Than an MRI DIY diagnostic guide. They could have just gone through a clinical exam and had somebody say, hey, look, most likely a disc problem, and educated them on this stuff. But people really believe that they need to see more. They just have to see it. And that's what they think is going to set them free and help them out. But it actually further indebts them to this fear and anxiety and worry that's associated with knowing that. All right, so multiple theories as to how the discs heal, right? So first things first, the disc retracts to its original position. That's a theory, right? Sort of like a balloon that bulges when you squeeze it, but then the bulge disappears when you stop squeezing it. So if I have a balloon here and I squeeze it, right, you're gonna say, boop, something's gonna pop out. But then when I stop squeezing it, I remove the pressure and or the stimulus, the negative stimulus in this case, then it goes back to normal shape. All right, so if you have a disc that is intact, remember extrusion, sequestration, those discs are not intact. We call them incompetent discs. The jelly has left the arena. All right, the disc material has gone through the disc. There is a defect in the disc wall, the annulus. So obviously you can't squeeze that and then have it come back in. All right, but if you have a protrusion, right, the idea is that, hey, could it retract? It's still inside. Could it just shrink? The second theory is, hey, the herniation reduced through dehydration. The disc material essentially just, it dries up. You have this bulge, dries up, gets absorbed, and then disc heals up. Disc desiccation or disc dehydration over time. And then there's one way that I theorize and or make sense of how these massive disc herniations heal. And I think it'll make sense to you, right? And research sort of supports this. I'm going to share with in a minute. But this is a research article, pretty interesting and pretty recent, the last few years. Lumbar disc extrusions reduce faster than bulging discs due to an active role of macrophages in sciatica. Macrophages or macrophages, these are the special healing cells that sort of gobble up the disc material, all right, and allow it to heal. Okay. So if you've done any research online, there's no shortage of folks referring to the discs as jelly donuts. I've referred to it as a few times because lots of people, it just resonates with them. They sort of get it. You know, most people have been led to believe that, hey, disc herniations are equivalent to jelly coming out of donuts. Look, I don't really love this analogy. There's nothing more frightening than picturing like the jelly shooting out of your donut. It didn't go out anywhere, all right? It's all pretty well contained, but at the end of the day, still freaky. But since it's a common analogy, right, and you likely heard it before, I'm just going to try to like put a positive spin on it. All right, so here's my attempt to do that. All right, so look, imagine you're an ant. I took some creative thinking to come up with this. Imagine you're an ant, right? And like most ants, you love sweet things. Maybe you like jelly, for example, okay? And you're walking down the sidewalk when you notice two jelly donuts. One donut looks like this. Pretty good. There's like sugar on the outside you can get to and all that, right? But at the end of the day, the other donut might look like this. Right? Now, that one, not only do you have the glaze and the sugar and all that, right? But you can also get access to the jelly. This is probably the sweetest part. Right? So which do you and your ant friends prefer? So imagine yourself, you're walking down the sidewalk, you're an ant. Which do you prefer? Now, look, I could be wrong. Again, I'm not an ant. But the one that's oozing jelly seems like a quicker, easier, and just like tastier treat. You can just get right to it. Getting to the jelly, the first donut is hard. It takes a lot of time. You have to go through that wicker weave of fibers, if you will, the annulus. All right? You have to eat through the outside of the jelly donut to get inside and try to like repair all that, right? It takes a lot of time and energy. All right, so what's the point I'm trying to make? All right? The more severe the disc herniation, that jelly donut that's open, if you will, all right, the more easily the body can reabsorb material because the jelly is exposed. It's exposed the elements, right? And outside of the disc or the donut. This way, healing cells, again, those macrophages, depending on who you listen to, can clean things up more quickly. They can Pac-Man it up, right? And you can get on with your life. And so look, it's just the way I think about it, but it sort of makes sense when you think about sort of the stages of healing. And again, if you put yourself in an ant's shoes, ants don't wear shoes. Anyway, so what this really means at the end of the day, okay, and hopefully this has been helpful to kind of educate you on disc problems, is that disc herniations do heal, all right? And you should not be scared of your image findings because oftentimes the findings are a normal part of life and they don't carry as much weight as you think or you've been led to believe. In fact, in most cases, the worse the injury, the worse the disc problem, the better your chances of naturally solving this. You might hurt more, it might be really painful, but chances are very high, okay, that you can solve this. So look, the next time someone tells you you've herniated disc and it can't heal, or that you'll have to live with this problem forever, it's just simply not true. Now, if you don't follow a process and you continue to nick the scab, absolutely, you can continue to live with a cut on the knuckle for the rest of your life. And so look, just checked my inbox actually before posting this and got this message from one of my viewers, right? I was checking in and he shot me a message back. Charlie, hi, I got some scary results and now I'm getting an appointment to meet my spine specialist. Right? I'm also getting copies of the images soon, but feel free to review my report. It means a lot. Thanks for checking on. Right? So you can see how like this just delays people from learning what they can do, what they have control of, their mind and their body, what they think, what they believe, how they move, how they don't move, what they choose to do with their lives. And they rely on this image, which is external to them, and it controls them. You've got this scary image, freaks them out, and because of that, right, they're emotionally involved in that image, and that image has so much power over them. Now they're going to see a spine specialist when they don't need to. I've got mild central disc protrusions, no spinal stenosis, but I've got this neural foraminal narrowing. What do I do? What does this mean? Scary stuff. And so again, if you're watching this, you've probably been freaked out by these things more than once. And so look, I get messages like this every single day, and it just ticks me off. I think it's really sad. I think it's an absolute flaw of the medical system. And it's just another person trapped by the results of their MRI and headed down the path of seeing a spine specialist who, by the way, can offer pills, shots, or surgery. And if you already know you don't want one of those things, why would you go there? Sort of like going to a pizza shop, right? When like you don't like pizza and instead you would rather have a taco, you should probably go to the taco truck, right? So many people, right, walk into the pizza shop when they want tacos and they're ticked to find out the pizza shop offers pizza. And so if you go to the spine specialist and you already know, I don't want pill, shots, or surgery, I don't want is what is on their menu, then why even waste your time? And I say waste your time in the sense that they might be able to give you another opinion or another thought. But really, you're the one in control of this. It's your pain experience. You probably created it, not your fault. But really, at the end of the day, it's what you feel. It's your experience. And so relying on other people, right, to always make decisions around what to do. Should you get surgery? Should you not get surgery? Right? All these different things is disempowering, if you ask me. At the end of the day, most people just need some education like this, some reassurance, and a good plan to solve things naturally. So look, if you are watching this, right, and you've stuck to the end, then thank you, right? Hopefully it's been valuable and sort of giving you some aha moments. Maybe you came into this, being very freaked out about what you've been told is wrong with you, but now you realize like, hey, it still sucks. Absolutely. Don't get me wrong, right? But I can actually heal this thing naturally. Like my body is designed to heal. Absolutely. Right. And with the right process, I could potentially solve this without needing surgery or, relying on pills or getting shots or things like that for sure. Right. And so what I would say is, look, if you are interested in learning the process and or getting sort of a window into the process that we use to help people like you all around the world, by the way, with back, butt, sciatica problems, heal naturally, then go ahead, check out this free workshop. Again, I'm going to share with you some different insights, tips, tricks, and thoughts around what you can do to solve this back, butt, sciatica dilemma, whether it be due to a disc problem, or maybe you're still not sure. Maybe you think piriformis syndrome is the issue, but maybe it's actually a disc. Maybe you just have burning leg pain, numbness, tingling, right? All these things are covered inside the workshop. So be sure to click the link above. You can register for the workshop, check it out, and become more informed. So that's all for now. Hope this lesson helps. All right. This is the end, and these are the references or some of the references that I used inside of this presentation. Let me know your thoughts by putting your comments below in the comments section. Thanks so much, everyone. This is Dr. Charlie. Until next time, take care, and we will chat soon.